Hi everyone, and welcome to another episode of our web series. As you notice, as you can see, I'm missing my colleague. He usually sits right next to me, Rubik. He wasn't feeling too good today, so let's wish him a speedy recovery, my partner in crime. This month's web series is very interesting. One of my patients gave me a lot to think about this month, and I wanted to make sure I share this with you with this month's web series. How does one choose an imaging center? How do you know when you go to that facility that from equipment to staff to protocols, everything is up to par? So I've decided to put a list of 3 things together that you as a patient can ask, and they're obligated to show you if you want to see it with your eyes, as far as the licensing and accreditation and all that. So let's get right to it. Okay, number 1, you want to make sure that the imaging center is accredited by ACR. ACR stands for American College of Radiology. It's an accrediting body that checks imaging centers to make sure that the machinery that they're using is, first of all, has the proper software, and the scanners that use radiation, they are using the proper amount of radiation, and there's no extra leakage or more radiation that our patients get exposed to. This is very, very important. So, you guys can actually look for this logo. This is the ACR logo, and I'm sure they have licensing and stuff that if you wanted to ask to see their ACR certificate, they should be able to show you. We're very proudly have all the stickers all around our windows, so I wanted to share this with you. It's very important. What ACR does is they also make sure that the exams that you're performing have the correct image quality, even from the readings by the doctors are done properly. So this is very important, and honestly, whoever has gone through ACR, it's such a grueling experience that it can take up to a year to get accredited. And make sure you ask for ACR accreditation. Number 2, let's go to the technologists. You want to make sure that the technologists are ARRT certified. This means that they have gotten the proper training and exposure, not just academically, but also clinically, in the inpatient settings, outpatient settings, that they will be able to perform, and they understand the scanners, and they'll be able to do a variety of complicated tests. This is very important. ART technologists are far more knowledgeable and far more experienced than the ones that are not. So that's very important. You can ask to see, make sure that the technologists that work at this center are ARRT certified. And number 3, the last one that I wanted to cover, is the reading radiologists. All doctors, all reading radiologists at centers must be board certified, which means that they're reading with today's standards, and the report that they create from the image will make sense to the referring doctors, and all the points will be covered. So this is it. I just wanted to make sure that I covered this with you, give you a little bit of an information as to what you guys can check for when you're choosing an imaging center. Just to review real quickly, number 1, the center must be ACR accredited. Number 2, the technologist must be ARRT certified. And number 3, the radiologist should be board certified. If there's ever a question, I wanted to cover this up before I wrap this up. You as a patient have the right to choose an imaging center. No one can force you to go to a certain place or make you go to a certain place. But that does not mean that you should not listen to your doctor, because your doctors have worked with a certain facility and they know the type of work that they do. So by all means, take their advice. But if you ever have a question as to if they're performing the correct exam or the facility is up to par, those are the things that you can always check, and I think that you should check. Thank you. That's all I have for this month. Everyone have a great day, and we'll see you next time.